weight, memory-damaging medications, and brain health. Did you know that some common medications can harm your memory and brain health? Have you ever asked if the medications you're taking could be contributing to your cognitive impairment? What if you could identify these medications and avoid them, thus improving your quality of life? Recent research has shown that memory loss is not solely a result of aging. Some medications, when taken without proper guidance, may have adverse effects on your cognitive abilities. How we can protect our minds. While we treat other health conditions, it's crucial to protect our minds. Studies show that proton pump inhibitors, such as omeprazole, and anticholinergics, which are prescribed to treat conditions like Parkinson's disease, increase the risk of developing dementia. We must be aware of the risks involved, as self-medication can exacerbate these effects. Stay with us, because the seventh drug we discuss is the most dangerous, and almost no one knows about it. We have included all the references we used to create this video so you can access them whenever you want. Let's start from the beginning. For a long time, dementia and cognitive impairment were considered inevitable consequences of aging. However, recent research has questioned this view and suggests that memory loss is not a normal and unavoidable part of aging. Dementia and Alzheimer's disease are caused by specific pathological processes in the brain, not merely by aging. Studies show that it is possible to maintain your cognitive faculties and even improve certain cognitive skills as we age, provided we manage the risk factors effectively. A balanced diet, regular physical activity, mental and social stimulation, and the management of chronic diseases such as hypertension and diabetes are all factors that contribute to brain health. There are also lesser-known factors that can accelerate or exacerbate cognitive impairment. For example, the abuse of alcohol and smoking can negatively impact brain health. Nutritional deficiencies, particularly in vitamin B12, as well as psychiatric disorders, also play a role. Understanding the underlying processes of dementia has improved significantly. Proteins such as tau and amyloid beta are important in plaque formation and injuries that damage brain tissue. Genetic factors can predispose some individuals to dementia, but lifestyle and environmental factors can significantly modify these risks. The prevention of dementia requires a multifaceted strategy that includes promoting a healthy lifestyle, managing chronic diseases, and considering medical interventions when necessary. Researchers continue to study new therapies and interventions that may slow or stop the progression of dementia. Understanding that cognitive impairment is not an inevitable aspect of aging can inspire change to promote brain health throughout life. Factors contributing to memory loss. Memory loss can result from a wide range of factors. Many well-known causes include aging and neurodegenerative diseases, but there are also less obvious yet equally important factors, such as substance abuse. Alcohol can cause direct brain damage, while tobacco use has negative effects on brain health. Traumatic brain injuries resulting from contact sports or accidents are another common cause of memory loss. These injuries can lead to immediate damage or long-term cognitive issues, such as chronic traumatic encephalopathy. Cerebrovascular accidents can also significantly disrupt blood circulation in the brain, causing damage that affects memory and other cognitive functions. Insomnia and mental disorders are directly related to chronic sleep deprivation, which alters the processes of memory consolidation. This makes it difficult to retain new information or recover existing memories. Chronic stress can also be harmful, as cortisol, the stress hormone, can damage brain structures involved in memory, such as the hippocampus. Memory loss may also be due to nutrient deficiencies, especially in vitamin B12. Vitamin B12 is vital for neuronal function, and its deficiency can lead to significant neurological symptoms, including memory loss and confusion. Psychiatric disorders, such as anxiety and depression, can also affect memory. For example, depression can decrease concentration and the ability to retain information, while chronic anxiety may hinder the processing and storage of information in the brain. Memory loss can result from several factors, many of which can be managed or avoided. By being aware of these factors, it is possible to manage and prevent their impact on memory. Common medications that can damage memory. Many commonly used medications may have harmful side effects on memory and cognition, something that patients often overlook. While these medications can be effective in treating various conditions, they can also lead to memory impairment and other cognitive issues. Below, we will explore how some medications can negatively affect the brain. 8 drugs that damage memory. Omeprazole. Widely prescribed to treat conditions such as heartburn, omeprazole is a proton pump inhibitor, PPI. This class of medications also includes lansoprazole, pantoprazole, and esomeprazole. These medications reduce the production of stomach acid. Proton pump inhibitors, PPIs, and brain health. Proton pump inhibitors, PPIs, are commonly used to relieve symptoms of gastritis and reflux. However, long-term use of PPIs has been associated with serious risks to brain health. Studies have shown that PPIs are linked to a higher risk of dementia and memory loss. In a study involving about 6,000 participants, 10% of those who took omeprazole for a period of 3 years experienced memory loss. In another study, 33% of patients who used this drug for longer than 4.5 years reported cognitive problems. The connection between PPIs, cognitive issues, and decreased absorption of vitamin B12 may be due to lower absorption of this essential nutrient. A deficiency in vitamin B12 can lead to neurological disorders and cognitive decline. Additionally, PPIs can alter the gut microbiota, which can negatively affect brain function. It is common for omeprazole to be used without a prescription, but it is important for patients to consult their doctors before starting long-term treatment with PPIs. The prescription of these medications should be preceded by a proper diagnosis of conditions such as gastritis or stomach ulcers. PPI treatment should generally be limited to periods of 2 to 3 months, depending on the patient's health status and necessary dietary adjustments. In addition to cognitive risks, prolonged use of omeprazole is associated with other health problems, such as vitamin deficiencies, kidney disease, bone fractures, and an increased risk of respiratory infections. To avoid complications in the long term, it is important to use these medications under strict medical supervision and with caution. Anticholinergics, the hidden risks. Anticholinergics are widely used to treat various conditions, such as Parkinson's disease, overactive bladder, and respiratory disorders. These drugs work by blocking acetylcholine, a neurotransmitter essential for many functions, particularly memory and learning. While these medications can be effective, they may have side effects on cognitive function. Studies have shown that anticholinergics increase the risk of dementia and other cognitive disorders. A study conducted by the University of Washington followed more than 3,500 adults for 10 years and found that those who regularly used anticholinergics had a 54% higher risk of developing dementia. This risk increases with the dosage and duration of use. Commonly used anticholinergics associated with cognitive impairment include meclizine, scopolamine, atropine, biparidine, oxybutynin, trihexyphenidyl, and diphenhydramine. These drugs interfere with neural communication, altering learning and memory processes. Some anticholinergics, such as glycopyrrolate and trospium, as well as inhaled medications like tiotropium, do not appear to cause these cognitive effects. However, the widespread and indiscriminate use of anticholinergics, especially among older adults, can contribute to cognitive impairment. Patients should carefully weigh the risks and benefits associated with anticholinergics and seek alternatives, limiting their use to the minimum doses and durations necessary. Anticholinergics are not only associated with cognitive risks but also with other side effects, such as dry mouth, constipation, and vision problems. It is important to be aware of these risks, particularly for vulnerable populations such as older adults. Corticosteroids and brain health. Corticosteroids are powerful drugs used to treat a variety of conditions, ranging from allergies and asthma to autoimmune diseases and inflammatory disorders. However, corticosteroids are associated with serious side effects, including deterioration of mental health and cognitive function when used for extended periods, particularly if taken orally. Studies have shown that corticosteroids can cause structural changes in the brain, leading to disorientation, anxiety, depression, or confusion. A British epidemiological study that analyzed data from over 500,000 subjects found that people who took long-term corticosteroids to treat asthma had a higher risk of developing dementia or other cognitive disorders. Prolonged use of glucocorticoids, such as prednisone or dexamethasone, is particularly dangerous as it can affect brain function by altering cortisol levels. Excessive cortisol, a stress hormone, can damage neurons in the hippocampus, the area of the brain responsible for memory. Even inhaled corticosteroids, such as fluticasone and budesonide, may have negative effects when used in high doses or for extended periods. In addition to cognitive risks, prolonged use of corticosteroids is associated with other unwanted side effects, such as osteoporosis, diabetes, high blood pressure, and increased susceptibility to infections. It is important for healthcare professionals to closely monitor the use of corticosteroids to minimize these risks. Patients should be informed of the possible effects and encouraged to use the lowest effective dose for the shortest duration possible to reduce dependence on corticosteroids. Whenever possible, pharmacological and therapeutic alternatives should be considered. Benzodiazepines, a silent risk to memory. Benzodiazepines are a class of drugs widely prescribed to treat insomnia and anxiety. These medications: benzodiazepines and memory loss. Benzodiazepines, including alprazolam and diazepam, are known for their calming and relaxing effects and can quickly relieve symptoms of anxiety. However, prolonged use can lead to severe brain damage. Studies have shown a clear link between benzodiazepines and memory loss. These medications can double the risk of developing Alzheimer's disease, potentially due to their damaging effects on the brain. More than 40% of respondents in studies reported experiencing various neurological symptoms, including lack of energy, nervousness, and difficulty concentrating, in addition to memory loss. Prolonged use of benzodiazepines is associated with other adverse effects, such as sleep disturbances, anxiety, muscle weakness, and myalgia. Physical and emotional dependence is another significant risk, making it difficult for many patients to stop taking these medications. The link between benzodiazepines and Alzheimer's disease is particularly concerning. Although the exact mechanism is unknown, it is believed that these medications can interfere with the normal function of neurotransmitters, resulting in structural or functional changes in the brain. Additionally, prolonged use of these medications can negatively affect the sleep cycle, which is crucial for memory consolidation. Given the severity of these risks, it is important to carefully limit and control the use of benzodiazepines. In cases of anxiety and insomnia, doctors should consider non-pharmacological treatments such as cognitive behavioral therapy, relaxation techniques, or lifestyle changes. If benzodiazepines are necessary, they should be used for a short period and at lower doses. It is important to be aware of the risks associated with prolonged use of benzodiazepines to protect patients' brains and promote safer and more effective treatment for anxiety and insomnia. Amphetamines and memory. Amphetamines are widely used to treat attention deficit hyperactivity disorder, ADHD. These medications are well known for their ability to improve concentration and reduce excessive hyperactivity in the short term. However, amphetamines are addictive and may cause memory loss if consumed for an extended period. They increase levels of neurotransmitters in the brain, such as norepinephrine and dopamine, which temporarily improve concentration and attention. However, their use can lead to a series of problems, including physical dependence, emotional issues, sleep problems, irritability, and even depression. Memory loss is a serious effect associated with the long-term use of these medications. Studies have shown that high doses of amphetamines taken over long periods may cause permanent brain damage. Prolonged users may experience memory problems, decreased motivation, and impaired cognitive performance. These effects may persist even after discontinuing treatment, indicating long-term harm. Amphetamines also pose a significant risk due to their potential for abuse and dependence. Misuse of these drugs can lead to serious complications, such as arrhythmias and digestive problems. Psychological dependence is another issue that can make it difficult for patients to stop taking medication, even when side effects are evident. It is important for healthcare professionals to prescribe and monitor amphetamines closely to minimize risks. Patients should be informed of possible side effects and advised not to exceed the recommended doses. Treatment for ADHD should include non-pharmacological approaches, such as behavioral therapy or stress management techniques. Amphetamines can be harmful to the brain, so it is important for patients to be aware of the risks. First-generation antihistamines, relief today, problems tomorrow. First-generation antihistamines, such as diphenhydramine and chlorpheniramine, are widely used to treat allergy symptoms and colds. These medications are effective in relieving symptoms such as congestion and itching. However, they have a dark side. Over time, they may negatively impact memory and cognitive functions. These antihistamines block the action of histamine in the body, which is responsible for allergy symptoms, and they also have anticholinergic properties, meaning they block acetylcholine, an essential neurotransmitter for memory and learning. Long-term use of these medications can lead to cognitive impairment. Studies have demonstrated an increased risk of dementia when first-generation antihistamines are used. A review of 138 articles on adverse effects found that the use of these drugs is associated with cognitive impairment. Patients who used these medications regularly reported problems with memory and difficulty concentrating, even after stopping them. Less harmful alternatives, such as cetirizine and loratadine, second-generation antihistamines, have fewer side effects and do not cause cognitive deterioration. These medications are preferred for the long-term treatment of allergies because they effectively relieve symptoms without the same health risks to the brain. First-generation antihistamines can also cause side effects such as drowsiness and blurred vision, which can significantly impact quality of life, especially for seniors who are more susceptible to these effects. Thank you for your attention. Subscribe to channel. I wish you good health, happiness, and wealth. Next video soon.